When you're doing panoramic radiographs, you may be wondering why you can't use an intraoral apron. The intraoral apron has a thyroid collar and an open back. When the panoramic machine goes around the patient, it comes at a 15 degrees upward angle and would catch the thyroid collar, and it would cover up some of the information that we need, especially on the apices of the teeth. That's why we have a specially made apron for the pan. The pan apron velcros in the front and comes long in the back. It covers the spine up. Now you can see that there is an area that is dipped below, and that is an area that we want to uncover because, as I said before, the pan unit is coming this way, and if it were here, we get, even with this apron, we'd get something that's called the shark fin. Before you take the panoramic x-ray, you want to make sure that you take off glasses, earrings, necklace, and any partials or dentures that the patient may have. Otherwise, you may get an image that has ghost images of the earrings. If you don't take out a partial, this is what a partial would look like if it was left in while you take the pan. We want to bring the patient in. You want to make sure that the patient is biting on this bite block. If she's not biting on this bite stick, what will happen is the teeth will be overlapped, and I do have an image of that to show you now. One other thing that you have to make sure that you have is the patient is going to be straight. If this side or the other side is too close, this side is going to be closer to the x-ray tube when it comes around, and it's going to be very magnified, as you can see in this image. Also, what you want to make sure is that you're in the focal trough. The focal trough is the area of interest of where the whole arch is. If it's too far forward or too far backwards, it's going to be out of the focal trough, and you can miss some very important things. You can see that we have an image of it out of the focal trough, and then we have it in the focal trough where we see that you can see a cyst with a tooth that would have been missed as a diagnosis if we left the first one. One of the most common problems that we see is that we see that the chin is not in the correct position. If the chin is too far up, the back of the head is going to be this way. It's going to have a line that usually will come over the top of the anterior apices, and also the smile line is very flat. We want to make sure that the chin is down, and you can see the infraorbital line. This line to the ear is parallel with the floor, and this is a picture of what the perfect image of a pan should look like. In wrapping up, it's important to use the correct apron, but also it's important to check your aprons on a monthly basis to make sure that your aprons aren't cracked or have any pinholes in it. What happens is that when you have a crack or a tear, the lead is being exposed to the patient, and you do want to replace the apron so that your patients can be safe. You can eliminate these cracks by hanging up the aprons properly rather than folding them in half and putting them on a chair.
Radiographs are an important part of dental diagnosis and treatment planning. You may be prescribed radiographs that will be used along with your clinical examination. Panoramic radiography is a commonly used imaging technique in radiology and may be a component of your radiologic examination. This image depicts the entire upper and lower jaws, including the teeth, on a single film. Panoramic radiographs allow visualization of regions that cannot be captured or are difficult to image on other types of radiographs, such as the temporomandibular joints and wisdom teeth. Panoramic radiographs may also be used to examine the developing adult teeth and to diagnose other common and less frequently occurring conditions. Panoramic radiographs are acquired with a film that is positioned outside your mouth. Therefore, you will not need to open your mouth wide nor have instruments placed inside your mouth. This image is taken with you in the standing position. First, you will be asked to remove all metal from the neck up, including dentures, earrings, necklaces, hair clips, eyeglasses, and facial piercings, as these objects will block the path of the X-ray beam. You will be given a lead apron to wear. Neck or thyroid collars are not used in panoramic radiography since they would block the X-ray beam. Next, you will be positioned in the panoramic machine. You will be asked to stand tall, and you may be asked to bite on a plastic stick with your front teeth in grooves on the stick, while your chin rests on a platform. It is important that you are centered on the stick, and the operator will make any necessary adjustments. You might see light lines which are used to guide the operator in positioning you. If you are missing teeth, other aids, such as cotton rolls, are used to help position you. You will be guided to grasp handles on the machine to help keep you stable and in the correct position. For a good result, your spine must be as straight as possible, and the operator may guide your head so that your chin is down and your forehead reaches forward. The machine may be adjusted slightly to bring your chin up or down into the correct position. You may be asked to smile while maintaining your position, and some further adjustments may be made. Supports will gently touch the sides of your head to help keep it stable. You will be asked to place your tongue flat on the roof of your mouth and to close your lips around the bite stick for the duration of the procedure. Now you are ready for the radiograph to be taken. The operator will leave the room or stand behind a barrier to take the image. The film and X-ray source will rotate around your head, but will not touch you. The exposure takes approximately 15 seconds, and it is important that you do not move during this time. You will hear sounds, such as a beep, and the normal machine movements. Once the image has been taken, the operator will guide you out of the machine, and you may be asked to wait while the image is processed and reviewed. This initial review does not examine the film for disease. Rather, it is assessed to make sure that it is adequate and all structures clearly visible. Occasionally, a retake of the image may be required with any necessary adjustments. Complete examination of the radiograph is done at a later time. The patient exposure dose of radiation is kept as low as possible in order to maximize diagnostic value while minimizing risk. Radiation doses from dental radiography are considered comparable to the levels of radiation to which we are exposed every day from natural sources, such as the Earth and space. Panoramic radiographs provide the dental professional with important information that is vital in the diagnosis and treatment planning for our patients.
components of the Vantage Panoramic X-ray system. On the vertical column, beside the alignment mirror, we have the adjustable Frankfurt plane laser, the rotating overhead support and C-arm, the temple support wands. The patient positioners and sanitary bite pieces are stored in a compartment on the positioning table. There are two different types of positioners, a bite piece and chin rest for panoramic exams and a TMJ positioner. On both sides of the positioning table, we have the control keypad, column height adjustments, temple wands control, and the alignment lasers. Below the positioning table, we have the Vantage Touch operating panel. Before introducing a patient for examination, we must prepare the system. If necessary, tap the cycle key on the Vantage Touch to bring the overhead to the patient entry position. Then, verify the yellow ready indicator. Place the Frankfurt plane laser in the lowest position. How to perform a standard panoramic exam, an enhanced panoramic exam, or a panoramic bite wing exam. Choose a procedure by tapping the Vantage Touch control panel. Verify your technique according to patient size and anatomy. Explain the examination process to the patient. Place a sanitary barrier on the bite piece. Explain to the patient that the anterior teeth will be placed within the grooves of the bite piece. Ask the patient to remove glasses and jewelry. Begin patient positioning. Instruct the patient to place their hands on the stabilizing grips. Gently guide the patient towards the vertical column. Instruct the patient to bring the toes in contact with your instep, which will be placed approximately 8 inches in front of the vertical column. Ask the patient to now stand at full height and relax the shoulders. Adjust the vertical height of the positioning table using the 2 control buttons and place the patient's anterior teeth in the bite piece grooves. Align the patient's head. Begin by drawing the Frankfurt plane laser up to align with the base of the patient's orbit and the top of the ear canal. Use the height of the positioning table to tilt the patient's chin higher or lower, bringing the Frankfurt plane horizontal. Move directly behind the patient and gently rotate their head to align with the projected mid-sagittal laser. Be sure to observe alignment from front to back as well as from top to bottom. Close the head support wands. Inform the patient to remain still. Ask the patient to smile and align the cuspid laser with the leading edge of the cuspid. Instruct the patient to close the lips around the bite piece. On the control panel, tap the cycle button once and verify the green ready condition. Instruct the patient to place the base of the tongue to the roof of the mouth as if swallowing. Ask the patient to remain still and hold their breath for the duration of the scan. Perform the examination. At the end of the exam, the overhead structure drives to the patient exit position. Advise the patient to remain in place until the overhead comes to a complete stop. At the end of the return movement, the head positioning wands will open. Assist the patient in stepping back and out of the structure. Tap OK to accept the image. At the end of an examination, the overhead structure is in the patient exit position. The gray ready indicator verifies this. Press the cycle button on the Vantage Touch once to bring the overhead structure to the patient entry position. How to perform the TMJ examination. To perform a TMJ examination, first exchange the panoramic bite piece and chin rest for the TMJ positioner. choose the TMJ exam on the control panel. Verify the technique according to patient size and anatomy. Explain the examination process to the patient. Ask the patient to remove glasses and jewelry. Place a sanitary barrier on the positioner. Inform the patient to stand at full height and draw the patient into the structure. Begin patient positioning. Instruct the patient to place their hands on the stabilizing grips. Gently guide the patient towards the vertical column. Instruct the patient to bring the toes in contact with your instep, which will be placed approximately 8 inches in front of the vertical column. Ask the patient to now stand at full height and relax the shoulders. Adjust the Frankfurt plane laser to align with the base of the patient's orbit and the top of the ear canal. After the Frankfurt laser has been set, use the height of the positioning table to tilt the patient's chin higher or lower to bring the Frankfurt plane horizontal. Move directly behind the patient and gently rotate their head to align with the projected mid-sagittal laser. Be sure to observe alignment from front to back as well as from top to bottom. Close the head support wands. Inform the patient to remain still. On the Vantage Touch, enter the Ready for Imaging position by tapping the cycle button once and verify the green ready condition. Ask the patient to close the mouth, remain still, and hold their breath. Perform the first scan of the TMJ examination. As the overhead structure drives to the patient exit position, allow the patient to relax, but advise them not to step out of the structure, even when the head positioning wands open. Verify the first TMJ scan on the Vantage Touch display and press OK. While the patient remains in place, return the overhead structure to the patient entry position. Once this movement is complete, realign the patient's Frankfurt plane, mid-sagittal line, and close the temple support wands. Again, enter the Ready for Imaging position by tapping the cycle button once and verify the green ready condition. Ask the patient to fully open the mouth, remain still, and hold their breath for the duration of the scan. Perform the second scan of the TMJ examination. At the end of the exam, the overhead structure drives to the patient exit position. Advise the patient to remain in place until the overhead comes to a complete stop. Assist the patient in stepping back and out of the structure. Tap OK to accept the image. At the end of an examination, the overhead structure is in the patient exit position. The gray ready indicator verifies this. Press the cycle button on the Vantage Touch once to bring the overhead structure to the patient entry position. If no further TMJ examinations will be performed, exchange the TMJ positioner for the standard panoramic bite piece and chin rest.